All right, folks, so Susie's going to show us, people oftentimes ask, what is ART, what is Graston? So Susie's in here every Tuesday evening and Friday afternoon to work on people. And so if you've ever wondered what that's all about, she's going to fix me and show you what it's about. So we'll start with neck and then knee.
Yep. So there's two different techniques that we use when we're doing soft tissue work here at the gym. One of them that we're going to go over first is ART, which is active release technique. Now this is very similar to what you guys do with your mobility work in the gym every day. Getting those muscles to lengthen, getting permanent tissue change is super vital. That's why we do 2 minutes on every spot that we're working on to get more permanent change. Well, this is just a little bit more intense and very specific to a spot that either is causing you some pain, maybe after a workout you just have a big trigger point. Anything along those lines, this is going to be a much better option for. Really quick fix. Usually this one is kind of one of those, you have one session and you're like, oh, it feels better. And then Graston work is going to be much different with chronic issues, so we'll go over that after. ART, the big goal behind it is getting some length and releasing the muscle. So say he was having trap pain and he had a big trigger point in his trap. What I would have him do, and this is what we would walk through with each person, is I would put pressure on the spot where the trigger point is, and then he would take a deep breath in. As he blows the breath out, he's going to move his left ear to his left shoulder. And he'll feel a little bit more intensity as he goes towards that left shoulder.
Feels great.
And relax. And we would do that over and over. So once again, deep breath in. Good. And relax. So the reason we're doing this is that when we're in that shortened, so the muscle is in a relaxed and shortened position, and we put pressure on it. And then as we move, we're creating more resistance and more pull. So we're getting deeper into that muscle that we're working on. Now, Graston, the next technique, this is going to work more specifically on scar tissue buildup, especially in a gym setting like this when we're doing a lot of repetitive movements, a lot of high intensity, a lot of weighted movements. We just have normal wear and tear and a little bit of, it's good stress, but repetitive stress over time. So sometimes we can build up scar tissue. Maybe there's just a little bit of a mechanical issue going on or something like that, or a past injury causing issues that have arisen, or an injury in the gym, and then we're trying to recover quickly and keep good mobility in that area. So those are going to be the reasons that you would do Graston work. So for the knee, the one thing that we would do is find out where you feel the pain, and then I would also go by where I feel the most scar tissue is where we would do the majority of the work. A lot of times too, it's going to be joints above or below, or muscle groups above or below, so we might have to do some work around the area of issue. Where are you feeling pain?
Feeling right at the top of the knee.
Okay.
And I think this is important too, because this is an injury from when I was in the Army, 14 years ago. So it's recurring, so constant maintenance. I think that's key to understand. That you're not always every time going to solve a long-term injury. Mm-hmm. It's about maintenance, and this is a great way to keep it.
Yeah, usually I recommend for one specific area, like one very specific area, very small area, at least 8 sessions. But this means also, because you may only see me twice a week or maybe once a week, you need to be working on it every single day at home, and you could do 8 sessions and see some really good results. The less often you do it, it's gonna take a lot longer to get there. Chronic issues are gonna be the hardest to take care of, because rest is like #1 thing to help manage it. So we're doing a lot of soft tissue work and rest, you can recover it much quicker. If you're going to keep working out, then you just have to know it's going to be a lot longer maintenance, or more maintenance every day, and then a little bit longer of a time to get better. So the concept behind this is we're going to be doing very small movements and very tight hard movements to break up scar tissue. It's much different than just a trigger point. It's almost bristly, so it feels like you're kind of going over gravel. So when we find those spots, so part of it is kind of finding where the area is. Go ahead and bend your knees slightly. Yeah. So that I can feel a lot better. So first we would do very isolated areas right around the knee, and then we would work also on releasing. There's probably some trigger points and things like that built up above and below, and so we would also do release work through there.
This isn't nearly as bad as the ART.
Yeah.
At least yet.
Well, and different areas hurt worse, and some don't hurt at all, and so it definitely depends.
So the idea is we're breaking up scar tissue to get more movement out of that muscle group, that segment, which then ultimately release pressure that's on the joint.
Yes. Yeah.
And you can feel, like I can feel the gravity.
Yep.
that you're talking about.
Yeah, you can definitely tell when it's a spot. It's either it's tighter and it has less give to it. That's definitely an area that we would need to work on. So
Cool. So two really great techniques. You can see the transference into the lacrosse ball work that we do in here, but having somebody who knows what they're doing work on is dramatically better if you can have the time, if you can make the time to do that. So she's in here every Tuesday and every Friday. Sign-ups at the gym. She's also a great resource for a ton of other things. So definitely check her out if you have anything you need